everyone, it's Hillary Topper here for We Are Triathletes. This is our weekly webinar where we showcase experts in the field. And this is specifically for We Are Triathletes team members. If you're a beginner triathlete, if you're a runner, join in and ask some questions. This is your opportunity. Today, it gives me great pleasure to introduce you to Dr. Marc Tazanowski. Dr. Marc is with True Sports Care, and they're in Wisconsin, but they work with people, athletes around the country, around the world, actually. So it gives me great pleasure to introduce you to him today, and he's going to be talking about foot and ankle issues.
It's probably plantar fasciitis, but in the same vein, patients will complain about an Achilles tendon issue, but those are the two main ones. A lot of times you'll have a rolled ankle, so there are other potential foot and ankle issues, but those are the two main ones that we deal with, is plantar fasciitis and Achilles tendonitis. So what we can make an assumption about, and again, without doing an examination on somebody, we just have to make an assumption, but we know that there's some tight structures, and the tight structures are going to exist pretty much on the bottom of the foot and in the Achilles. Now, a tight structure doesn't necessarily mean that it just needs to be loosened. It means that it's tight for a reason. The body doesn't typically do things arbitrarily. It always does things, purposefully. So if it's trying to make the plantar fascia tight, then it's typically a causal relationship from the calf being tight. And most types of treatments that you read about online will go into the fact that you should be foam rolling your calf, or you should be stretching your calf, or you should be, taking a golf ball to the underside of your foot, or an ice bottle to the underside of your foot. And all of those things are good at treating the symptoms that are manifesting, but they don't necessarily get down to the root of why that calf or why that foot is tight in the first place. And that's what the diagnostic testing that we do, or the muscle testing that we do, uncovers. And the best way to put it is that if you're treating your symptoms by foam rolling, by stick rolling, by using a golf ball, you might be making it feel better for the moment, but most likely you won't get long-term relief from those treatments. If you travel up or down the kinetic chain and you start investigating why those structures are tight in the first place, and you find out the real reason, once you correct that, then the problem goes away without even addressing the symptom area. Originally, it was a hands-on thing, and then we stumbled upon the ability to do it virtually by accident. So my brother-in-law, who really...
Sorry about that.
I was gonna say, I don't think that's me. So my brother-in-law, who lives literally about an hour away, was complaining about a sciatic type issue. And I said, I don't have a chance to get out there immediately, but in the interim, why don't you try these exercises that we have posted on our YouTube channel? And he literally tried the exercises that I gave him. And again, it was just a guess. It was a Hail Mary pass, but he did the exercises and he wound up getting full relief in probably 3 or 4 weeks. Then we had some additional folks who were either in school or they were somewhere where they couldn't get access to the treatments, the hands-on treatments. But we did a Skype session. And from the Skype session, they wound up learning that they could correct some of their issues as well. And then finally, we did it with somebody who is absolutely green, who's never been exposed to our treatments, never been exposed to the office. He's from Minnesota, and he complained specifically about plantar fasciitis. So we started working with him, and rather than doing muscle testing, we basically run him through some movement patterns or some pattern analysis. And once we did that, we said, hey, these are the most commonly disconnected structures when it comes to a plantar fasciitis issue. We taught him how to do the corrective exercise work on his own. We taught him what he was supposed to feel when he did the corrective exercises. And I think I had 3 or 4 sessions with the gentleman, and he said that he feels like he's well on his way to being 100%. And that's after going to hands-on physical therapy back in his home state of Minnesota. All right, so here's a good first one. Now this is the exercise that I like to use for hamstrings. Let me just see if I can get a better vantage point. All right, that should be pretty good. So the idea is when we do a hamstring exercise, you can do hamstring curls in the gym. You can do a lot of hamstring type exercises that you've seen, traditional physical therapy type exercises. But what we do is we make sure that we take out all the potential cheats. So that way you can't use your low back for help. You have to be mindful of not using your calf for help. So those are the things. Again, we're very, very, very nitpicky about what the athlete is supposed to feel. And when they feel it properly, then they start to get a lot of results. Let me get a pillow for my knee. I have sensitive knees. All right. So from this position, you would put a knee down on the ground. This I consider this a lunge position. Now in a lunge position, I want to have the person put their body weight over their leg. They can put their hands on the ground. And in this position, you can see that my back, the contour of my back, if I tried to arch my back, it's almost impossible to do so. And we find all the time that the low back or the weak hamstring asks for help from the low back. So in this position, low back cannot help. All we have to be mindful of is not doing anything with the foot. So we're not dorsiflexing, we're not plantar flexing, we are keeping our foot completely relaxed. And as we bring our leg up, all of that effort is going to feel like it's coming from the hamstring area itself. And it should feel very challenging. The more you move your hips forward, the more challenging it would be. The more you move your hips back, less challenging it would be. One of the other things in this exercise specifically is that if you move too far forward, as you bring your leg up, you may feel too much of a stretch in the front of the leg. And we don't want that to be the primary sensation. We want the primary sensation to be in the back of the leg. So you have to kind of back off a little bit until my hamstring or the back of my leg is really doing most of the work. I would probably say that it's less of a direct and it's more of an indirect. You know what it is? It's that a lot of times these weaknesses are, I don't want to even say that they're perceivable because they may not be perceivable. Usually the weakness is not the area that complains. The area that complains is usually the tightness. So for instance, I'll give you a scenario played out. Plantar fascitis patient would come in. They would say, I have pain in the bottom of my foot. We'll do our analysis. I would say that a good 75% of the time, the weakness exists in the glutes or the glute max, not necessarily the hamstrings, although they can contribute for sure. I guess the reason why glutes contribute more than anything is because most of us who do triathlons, marathons, whatever it may be, we still have jobs during the week, and our jobs during the week winds up planting our butts in a chair. And when our butts are in a chair, then our glutes for 40 to 50 to 60 hours a week don't really have to do too much. So they kind of go to sleep a little bit. Then on the weekend, when you're doing your long run, your body's saying, hey, glutes, I need you to help me. And they're going, you know what, I'm done. I don't have to do too much. So then your calves may have to do more work. Your quads may have to do more work. And that's what a compensation pattern essentially winds up being. It's great because we have that redundancy ability in our bodies, but unless we get equal volume from each of those muscles, we're not essentially efficient. And for any distance athlete, efficiency is critical. The best advice I can give anybody, and we talk with hockey teams, we talk with gymnastics teams. I'm going to a cheer practice later today, so you can see that it's not sport specific, it's human kinetic specific. So we pretty much can pick out all the patterns that any sport pretty much has. The thing that I want athletes and coaches and anybody to start to really be better at is to identify these compensation patterns before they present with pain. So pain is the main reason, that's the main driving force why somebody would even come to the office. But pain already means that there's been some type of a dysfunction there for quite a long time. You know what? I have a chart. I'm just trying to think if I can pull that chart up. You know what? Maybe I'll just kind of bring that chart to you another time. But the chart talks about the different patterns of, you have a compensation pattern. From the compensation pattern starts to build muscle imbalances. The muscle imbalance starts to create tightness and weakness somewhere. That eventually winds up resulting in a sprain, a strain, an itis, osis, apathy. After that, you start to develop arthritis and joint dysfunction and labral tears, etc. So from all of those things, you can kind of trace it back and you can go, all right, well, what was the original cause? And the original cause was a muscle imbalance. So with our muscle testing and with our pattern analysis, we can pretty much We can pick out these movement pattern dysfunctions before they start to get to the point where they create these issues. When you are analyzing yourself, I love foam rolling because you can essentially foam roll, let's say your left IT band, you can foam roll your right IT band, and you can find an asymmetry before it becomes apparent and before it presents a problem. If you're stretching and you stretch your left quad, you stretch your right quad, you should analyze yourself in two ways. Say, does this feel like it's loose in general compared to other people and how they stretch, or is there an asymmetry? And if there's some kind of an odd tightness, we put people through this movement analysis in the beginning. Can you touch your toes? If you can't touch your toes, something along the posterior chain, it could be your low back, your butt, your hamstrings, your calves, your Achilles, any one of those things, something can be tight. I'm not quite sure what it is, and I don't know what's causing it because, again, we have to do the analysis, but I can definitively say that something is kind of tight. If something's tight, it doesn't mean, it means that you can try to stretch it out, but if the stretching doesn't give you permanent relief, which I've never found that stretching gives anybody permanent relief, then you got to investigate why there's a tight structure in the first place. And again, learning how to correct that tightness is what gives you more of a permanent result. Our exercises are not designed to be done forever and ever and ever. Once the correction is made, then maybe you have to do it for 2 weeks, 3 weeks, 4 weeks, or a month. But then after that, it should stay corrected and it shouldn't get back to that place where you're tight. So the website is truesportcare.com. That's truesportcare.com. Truesportcare.com. The office number is 631-584-TRUE. And if you'd like to contact me directly, you can email me at Dr. Taz, that's DRTAZ @mac.com.